Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And here at Gold, our team is preparing for the upcoming Gold Lactation Online Conference of 2020. And before each conference, what we love doing here at Gold is checking in with our speakers just to see what they're working on, get a little bit of information about the presentation as well, and just give you, our listeners and viewers, a way of getting to know them a little bit. And here with me today is Mona Lisa Hamlin. Welcome, Mona Lisa.
Hi, Kristen. Thanks for having me.
It is so lovely to have you here with us today. And Mona Lisa, you are the presenter of our closing keynote presentation.
hmm
Yeah, and that's very exciting. And we're going to talk about that in just a little bit, but I want to give our listeners a little way to get to know you. And I know you're an IBCLC and you have a master's in science of nursing. But I want to take you way back. I want to know, when does your love for lactation, when did that all start for you?
Oh, wow. Well, actually, I will say my journey into lactation started when I had my first baby, who is now 16 years old.
Oh.
But my love for lactation actually didn't start until about 4 years later when I became a NICU nurse. And the
Mm.
reason why is because I really didn't get a lot of support to try to breastfeed my older son.
Mhm.
And I didn't really understand at that time what I potentially was missing out on.
Mhm.
And it wasn't until was caring for the most vulnerable populations of both our premature babies who were the sickest of the sick and mothers who had either delivered early or had their own maternal health complications that I realized that I wanted to dive into all that human milk and breastfeeding could offer our moms and babies. So I kind of came about it a little backwards than maybe some others would anticipate.
Mhm. But that's absolutely wonderful. So you really, that sounds like you have such passion for the field of lactation, and coming through the the area of NICU, when you see really the most vulnerable little ones, and then seeing, this is such an important topic here, and so important for these little ones to get these the benefits of human milk, right?
Absolutely. Yeah, and I find it to be really interesting how we sometimes forget to incorporate breastfeeding into the entire care for both mom and baby. And that's some of the things that we'll be
Mm.
talking about in my presentation.
Absolutely, yeah, and I'm gonna we're gonna talk about that in just a moment. I'm so excited about this presentation. Yeah, and in the NICU too, and you just mentioned something that's really, really important. We have overlooked the benefits, not only for baby but also for mom, right? To have that connection, to have that bonding, that experience. Can you talk a little bit about that?
Yeah, I think it's really important that we ensure that the resources that are needed for mom to understand what her goals are, the importance for both her baby and her, right? The healing
Yeah.
factor, the medicine factor for the baby, but also for mom, both on a physiologic standpoint, but also on a mental standpoint, that we have those resources readily available from every provider, every clinician, every nurse, dietitian, speech therapist, etc., and not have a mother need to seek resources or help or support outside of the NICU where her baby is being cared for.
Hmm.
There's certainly complementary services that we want a mother to be able to tap into, but we want where her baby is growing and hopefully thriving to be all encompassed as well with the supportive services and care that she needs.
Absolutely. So, Mona Lisa, you are also the nurse manager of perinatal resources and community programs for the Women and Children Services line at the Christina Care Hospital in Newark. Uh, Talk to me a little bit about that. That sounds like a really, really great program, and I want to know more about what you do there and what the program does.
Yeah, so we actually have a small department that houses about 5 programs within it. We have a parent education program, so we do all of the prenatal classes from labor basics all the way through to newborn, CPR, breastfeeding. And then we also have an OB PEP program, and that is where we screen mothers with known medical complexities or challenges, or even if they're pregnant with a fetus that may have an anomaly, to ensure that we are in the background coordinating care so that when they come into our health system, we are very well prepared for them to have optimal outcomes. And then we have our inpatient lactation team that goes throughout our service line in every unit. And we have an outpatient lactation program as well. And then we have finally our breastfeeding peer counselor program, which is a WIC funded program which helps mothers who are WIC eligible achieve their breastfeeding goals. So it's a really phenomenal
Yeah.
set of programs. And then we make those connections from the hospital to the community so that we're really holistic and well rounded in our approach.
Well-rounded indeed. It sounds wonderful from what you're describing there. It really fills the gap of many things I've seen in practice here, right? The educational gap. I mean, you said you have education, childbirth education classes, breastfeeding classes as well, and infant CPR and all that. But then also the screening side, because some question I get as a midwife often is, okay, if I do all these prenatal screenings, what do I do with the information? I want to keep my baby, but in your case you have this whole program that
Yeah.
you have all these specialists lined up so to assist the families in case something shows up, and then of course lactation so important, and you're not only focused on when the family is in the hospital, but outreach as well into the community. I think it's fantastic, and I wish we could replicate your program everywhere. um,
Yeah.
are you have you seen any efforts that is being replicated, or is it something you're thinking maybe about that you could take to other hospitals or other communities as well?
So I would love to see that happen, right? I think in my mind, this truly is assuming population risk and really targeting optimal outcomes. I think what we find at many hospitals as those programs are kind of separated,
Yeah.
but it's really beneficial to have it under one umbrella to not only target, just breastfeeding, but to marry that into the piece around what mother's challenges may be when she comes to deliver at our hospital. And so I think that's been really well received in regards to having the clinician, the provider who's going to be caring for her and the baby, um, be knowledgeable about what the mom and baby are bringing to the table. So that's been great. I would love to see that replicated.
Absolutely. Now, you're also an advocate for, of course, health equity, and I saw that, and that is something so important. As we know that the rates here in the United States are still very, very poor. We see, that Black women have a much higher rate of morbidity and mortality in childbirth than their white counterparts, as well as Black babies there. So, tell us a little bit about your work in that field as well.
Yeah, so this is where I have an opportunity to not only be an advocate for health equity and really talk about the importance of expanding beyond the disparities that we see on the surface, but really looking at what could potentially impact those disparities, right? And really
Mhm.
looking at our social determinants of health. And there's many factors that we as healthcare systems really need to challenge ourselves to look outside of our four walls into.
Yeah.
What type of education is available? Is it high quality? What type of social support does this mother have or the family have when they're preparing to give birth for their baby or even after they've delivered? And what does
Hmm.
that look like to access our care, and do they have transportation to come back for their visits? Some of these
Absolutely.
things sound simple and they may even sound separate than the healthcare system, but what we know is that when we can create a full inclusive system that really can kind of create that safety net for the mother,
Mhm.
her outcomes are going to be much more improved. And so that's been beneficial to be a part of within my healthcare system, as well as cohorts of hospitals that are striving to decrease our disparities. And it's a great
Yeah.
opportunity to bring breastfeeding in as well.
Absolutely, breastfeeding so important. And please correct me if I'm wrong with my statistics here. I've seen that, of course, the initiation rates are lower for breastfeeding Black babies, but also the rate at 3 months is the from what I can see the biggest gap, right? So what do you think is happening there? Is that a lot of lack of support that Black families have when it comes to breastfeeding?
Yeah, so you're absolutely right. The initiation is lower. It's much higher than
Hmm.
it has been in the past, which is exciting to see. But certainly there's a significant drop at 3 months and
Yeah.
then of course at 6 months as well. I
Hmm.
do think that there is an often lower level of access to care, whether it's
Mm.
access to a peer counselor, a CLC, or a lactation consultant, or just a knowledgeable clinician, whether it be the physician or a nurse. We
Right.
also know statistically that unfortunately, our bias plays into that within the healthcare system. And there are times where a woman may present herself and seeking information, but research shows that that's not always given on an
Yeah.
equal basis to an African American woman or a Black woman as it is to her white counterpart. And so a lot of that has to deal with continued bias that's within the infrastructures that we work within.
Hmm. Yeah, that makes a lot of sense. Now I'd like to pivot over to your presentation. This is really exciting. It's a great topic, and you're going to be presenting on breastfeeding as a preventative care change model, how to affect change. And oh, when I hear that, my heart gets really full because I can only imagine that we can have change, right? So tell us a little bit about what you're gonna be presenting on.
Yeah, so we can certainly have change. And I think that one thing that we do in the field of lactasia is we kind of are in our bubble, right? We're
Yeah.
used to talking about breastfeeding and human milk within our own circles. And it really is time to be creative on how to expand beyond just our breastfeeding supporters and really get the ear and support and help and movement of other clinicians that are within the maternal child field as a whole. And so really looking at models that we can utilize, such as Cotter's change model, and that's what I'll be talking about,
Mhm.
to start to strategically look at, I identify a change that needs to happen. I've got to really get other people on board so that we not only initiate the change, we make sure that it's something that is bought into by other parties and stakeholders, and that we create a plan that is sustainable so that we don't just
Mm.
start something and end it. Because I think that's something that we see, especially
Yeah.
when grant money is available, for
Yep.
example, right? We may start something because we have funding in the immediate future, but then when that funding changes, that initiative or that new program starts to fizzle out because there's lack of
Mhm.
funding or focus on it.
Absolutely. And that is so, you brought up is such a valid point. So once the funding is gone, it is really, really hard to maintain certain programs. And that's exciting that you will be presenting on that there is a way to maintain and get other, shareholders involved in this. Now, we have also a lot of listeners and delegates from all around the world. So how will this be also applicable to their environments?
Yeah, absolutely. I think whenever we're talking about change specifically, right, regardless of whether
Mhm.
you're in the US or any other
Right.
country, we do want to be strategic about it. And we do want to think about how we're engaging other people and kind of
Yeah.
pulling at their heartstrings,
Mhm.
right? Because that's something that's not just in a silo of America. So I will certainly be bringing my examples from the country and state that I work within,
Right.
but I think that that could certainly be replicated anywhere that someone lives. With or without resources, it's really getting the stakeholders buy-in and really
Mhm.
looking at what we can do with the small amount of time that we have and capacity that we have.
Absolutely. Oh, that sounds wonderful. I can't wait for your presentation, Mona Lisa.
It'll be fun.
Absolutely. Well, thank you so much for spending time here with me, sitting down and chatting a little bit and talking about your presentation. It's been an absolute pleasure.
Thank you so much. Take care.
Thank you. And for our listeners now, the presentation Breastfeeding as a Preventative Care Change Model, How to Affect Change, will be presented live by Mona Lisa on April 27th. And it's our closing keynote here at Gold for the Gold Lactation Online Conference of 2020. Our closing and opening keynote presentations are always open access and free of charge. So please make sure you reserve your seat and share this with colleagues and friends in the field. It's going to be a fantastic presentation. You don't want to miss out on this. And also, if you would like to find out more about the Lactation Conference, I can tell you it's a fantastic presentation. We have 26 expert speakers delivering over 28 hours of education. And this is the 14th year for this conference. And this year also we have added more interactive elements. This year we have also panels, we have workshops and ask the experts. So it's going to be a great atmosphere of learning here, great focus on the field of lactation. We have representing over 80 countries, over 3,200 delegates will be joining this conference. And so make sure you be one of them. To find out more about this wonderful keynote presentation and all the other presentations in the conference, please visit goldlactation.com. Thank you everyone for listening, and we hope to see you at the conference. Bye bye everyone.